My name is Edward Norton, and I'm a professor at the University of Michigan in the United States, and I teach in the School of Public Health and in the Economics Department.
How would you explain what you do to a layperson?
I study the economic incentives in health and healthcare, including long-term care. I study incentives for people buying long-term care insurance, for quality of care in nursing homes, and more recently have been very interested in studying how government policy affects post-acute care, in particular long-term care after someone leaves a hospital.
And what would you say are currently the three main policy priorities for long-term care in the United States?
So I think the biggest policy issues for long-term care in the United States are the fragmented care that we have in the United States. It's a system that's very complicated to explain briefly, but there are many different payers, many different ways people can get care, and that creates a very fragmented system it's very hard for people to go from one part of the system to another, so the transitions between hospital to nursing home to home health to home, possibly back to the hospital, those are very, very challenging for the patient, for continuity of care. And so figuring out, there are a lot of issues around that fragmented care, quality of care and financing and just ensuring that the patient has a good experience. So many things around the fragmented nature of our system.
To what extent do you think these priorities have changed in the last 5 years, if at all?
I think the problems around fragmented care have continued, and they're changing though. Over the last 5 or 10 years, the United States government has put more emphasis on what they call episodes of care, following people from the hospital to care after hospitalization. And that is working, the idea behind that is to reduce fragmentation of care, to improve the transitions from hospital to nursing home or home health care. So ideally going forward, that will improve, but it's still, there's still big challenges now. So focusing now on what happens to patients when they leave the hospital, because patients generally spend very few days in the hospital relative to other countries. So what happens to them after they leave is very, very important.
And if you had the opportunity to introduce one new long-term care policy in the States, what would it be and why?
That's a challenging one, but I think any way that we can find a way to reduce the fragmentation and increase the coordination across the different providers, in particular hospitals and nursing homes and home health agencies, in order to provide the right incentives to have patients in the setting where they're receive the best care and most comfortable and at the lowest cost. That would be the best thing, and unfortunately that's a very hard thing to do, but that would be the ideal, is to find a way to improve the care for the patients at lower cost in a more seamless way.
In terms of research priorities, what do you think is an outstanding piece of research on long-term care that needs to be carried out in the United States?
So I think ways that what would be most interesting is to find do research to see how we can improve quality of care, and in particular reduce the readmissions back to hospitals and to have patients spend more time at home. So anything we can do to do research on changing the funding or changing the incentives so that patients are able to spend more time at home with higher quality, that would be terrific research.
Now I'm going to ask you a few quick questions. I'm looking for a number in response from 1 to 10, where 1 is low and 10 is high. So what policy priority is allocated to long-term care in the US?
Well, that's fairly low. A lot of long-term care policy ends up effectively being on Medicaid, which is the state national insurance system for people who are relatively poor, and that has relatively low priority in the United States, so maybe a 2. Some of it is also covered by Medicare, and some of it is done privately. But long-term care policy is certainly, I think, less important and less visible than hospital and pharmaceutical policy in the United States.
And how aware is the general public in your country of what the long-term care system offers to them?
I think in the United States, most people who have not yet had any direct experience with it are not very well informed. There's a lot of misinformation about the amount of insurance that people have. Most people think they have better insurance than they really do for long-term care. And unless someone has gone through it recently with a relative, I think people are fairly uninformed. In terms of how well aware people are, I would say probably a 3, although people who have more experience will be much more aware of it, and people who have not had any experience recently would be even lower than 3.
And how well does the system support people with long-term care needs?
The system supports people with long-term care needs in a variety of ways. I think those who have more finances are better able to deal with that, either hiring help or are able to find the most appropriate care. Those who are less well off have a much harder time. The quality of care in many nursing homes is not that good, and because many people who don't have other long-term care insurance end up on the Medicaid insurance system, which doesn't pay very well. Nursing homes are more reluctant to take those patients. There's a lot of concern about the quality of care. So I would say it's quite variable, and it's considerably worse when people have less resources. So I'd say overall maybe the system supports people maybe at a 3, again quite variable with some better than others.
How well does the system support the needs of carers?
That not very well at all. Again, maybe around a 2. There really are not, there are really no systems to support carers. And there's been some very good research that shows that carers often end up in worse health themselves, often will quit jobs or no longer work full-time, and so give up a lot in order to become a carer, and the carer's health often becomes much worse if it's informal care. So that is a real problem for a lot of family caregivers.
And finally, how integrated are social care and healthcare services in the United States on a scale of 0 to 10? Sorry, 1 to 10.
So how well integrated is care in the United States? Again, very, very poorly. 1, although it's trying to move it up in the direction of at least 2 or 3. Again, there are many different payers. Some people pay out of pocket. Some people care is paid for by Medicare, which is one insurance system. With others, it's Medicaid. Some people have private insurance. There are different systems for people who are veterans of the military service, or for those who have developmental disabilities. And these many different systems and providers, again, making a very fragmented system, and it's very challenging not only to get care within one system, but to move across different providers.